See You Now is a podcast highlighting the innovative and human-centered solutions that nurses are coming up with to solve for today's most challenging healthcare problems. Created in collaboration with Johnson & Johnson and the American Nurses Association and hosted by nurse economist and health tech specialist Shauna Butler.
I'm Shauna Butler, the host of See You Now, a podcast that shines a light on the nurses addressing today's most challenging healthcare problems, and never has that light been as important as it is right now. Over the past few weeks, See You Now paused its regular format so we could share stories from the nurses in the midst of the coronavirus pandemic. As the world works toward breaking the chain of transmission and responds to the massive disruption COVID-19 has brought to our ways of living, learning, and working, communities across the globe have experienced extraordinary social solidarity with the prevailing sentiment of, we are in this together. And while we've come together in mutual support and understanding, there are a few who believe the necessary public health measures are too broad, too costly, and in some parts of the U.S., they've taken to the streets to express their opinions and protest shelter-in-place orders that have closed non-essential parts of our economy. Their voices have been loud, their actions intimidating, and their opinions in conflict with science, evidence, and public health and safety. Nurses have a long and impressive history as health educators and meeting people where they are, and that means going to where the need is. In teams or as individuals, nurses bring their skills, knowledge, and advocacy to the front line, even if that front line is in the streets at a heated protest. On this edition of See You Now, we hear from 3 nurses who did just that, motivated by a commitment to educate the public and share the science, the facts, and the health risks. On April 20th, 2020, they donned scrubs and masks and stood silently as protesters swarmed the Arizona state capitol, and with their silence, they spoke volumes.
We wore masks, we wore scrubs. Our goal was to go down to the Capitol, stand there quietly, stand 6 to 8 feet apart, and just make a statement.
My name is Brittany Schilling. I am an ICU nurse here in Phoenix, Arizona.
My name is Jasmine Bhatti, and I'm a registered nurse. I work clinically at the bedside. I'm also a PhD student at Arizona State University.
My name is Jade Juriansz. I work as a neurology, ENT, and neurosurgery nurse. I'm currently redeployed as part of the swabbing unit in a testing tent at my hospital.
On the Monday of the protest, Jasmine asked if I'd like to go down to the protest and stand silently.
The protesters that were coming to the state capitol were protesting our governor's stay-at-home orders that were put in place to help slow the spread of COVID-19.
The protesters were wanting to open the state, and being healthcare workers who are working directly with COVID, we feel that we're not quite ready to do that. I believe that it is the nurses' duty to educate the public and show people this is very real, and these are the steps that we can take to protect ourselves and those around us. And the whole point was just to be a voice for our patients who don't have the chance to talk to the public right now and tell them this is very real and it's scary, and we need to be careful and prudent with our resources to make sure that we are getting this virus under control.
We wanted to be exactly who we are as nurses, and that is advocates for our community, and be that voice for our profession, really to show that science is real, and we really need to be looking at data and numbers and giving our scientific community the opportunity to participate in decisions that are being made at a governmental level.
Calling it counter-protesting narrows it down to black and white, which it isn't.
Yeah, I guess we were seen as counter-protesting, but mostly we were there as advocates. Like we have said, we were there to advocate for our patients and their family members, and then also for healthcare workers as well, who have worked so hard to protect our patients. As I'm walking up to the Capitol, there's people honking and driving and yelling, and there's megaphones, so it was very loud. I right away was kind of thinking, oh wow, what did we get ourselves into?
I think a lot of people who showed up were just understandably scared, afraid that they were going to not be able to pay their bills or to feed their families.
I had to look at each person, and when I looked at them in the eyes, I just saw that this is someone's loved one. It's someone's mother or father, and they're here for a reason.
That day, me and my fellow nurses who were there became the face of the enemy.
We ended up standing in a crosswalk that was across from the Capitol, and as everyone left the rally, we were standing right there, and they all walked right past us and went to the Capitol. So then after they had passed through us, that's when we went to go stand in front of the Capitol. At that point, there was hundreds of people around us. There was quite a few groups of people that came up and talked to us.
We didn't expect the level of hostility of what we received.
It was definitely very threatening. One, I was surrounded by so many firearms.
There were times when I was surrounded on all sides by people who very obviously did not like me and had something to say about me and were getting more and more upset.
Oh, they were chanting all sorts of things, and I don't think I'll ever forget them. They are burned in my brain.
I was called a murderer.
Fake nurse, you're an actor. You must work at an abortion clinic. You're a baby killer. That really hurt.
One person who every single time that he passed me would blow cigarette smoke in my face.
Then there was a woman that came up to us and said, "You're just too young. You don't understand. You don't have any experience. You must be fooled. They have you fooled."
The fact that we stayed silent really made a lot of people angry. Part of the way that I handled their level of anger is to have compassion. I do have compassion for every person who was yelling at me or threatening me at this protest. And I was standing up for every patient that has died and every patient who is currently fighting for their life or will fight for their life.
Looking at how much recognition we've received around the world, it's been incredible, and we hope that we've made at least a tiny impact.
If no one had been standing there, I think that the story that would have come out from this was that Arizona wants to open up, and that was it. What we were able to achieve by our silent protest was to change the narrative.
I am so proud to be a nurse, and I am so proud to be amongst the greatest people really in the world who are providing care with their hearts and souls and doing it every single day. I want them to keep going and to always look ahead. And this is a time of so much growth. And I really think this is the time that nurses can step up. How do we take all of what we've learned now and really turn it into something magical?
What does it mean to care? What does it mean to meet people where they are? In the face of fear, nurses can provide knowledge, guidance, support, and compassion. They can bring light to darkness, wherever that darkness is, just as Florence Nightingale did with her lamp. While thinking of the courageous nurses who are on all the different front lines every day, I'm hearing a stanza from a new poem by nurse and poet Molly Case. Hold your pen torches high. Hold your pen torches high to car park cries and angry tweets asking why, to those that rejoined and those on standby, to the earth's clearer waters and cloudless skies, to the people that stayed at home with the days drifting by, to the nurses and midwives and all those who've lost their lives, to all of them we know that didn't have to die. Hold your pen torches high. With so much swiftly changing information about the coronavirus coming at us every day, indeed, it's hard to keep up and not feel overwhelmed. As nurse Jade Juriansz said, this is not a black and white issue. The shades of gray at times have us so confused, we just want to pick a side. It's easy to think in terms of us versus them. But the truth be told, this pathogen wants to take us all out. We must work together, even while apart, to make it through to better times. For See You Now, I'm Shauna Butler, Thanks for listening. Stay safe and hang in there.
Johnson & Johnson and the American Nurses Foundation are excited to launch the Coronavirus Response Fund for Nurses. Go to the American Nurses Foundation website to learn more, share, or donate. And thanks.